team, I'm so excited to present to you the 3.0 SonoSimulator release. This release is loaded with upgrades and new content. We'll start with an overview of our enhanced user interface.
Hello everyone, I'm going to give you a walkthrough of all that's new in the SonoSimulator with this latest software update. At the login screen, on the left-hand side, you'll see images of all of the new content that's available in this release of the SonoSimulator. Once you log in, you'll be taken to our brand new main menu screen. At the top of the main menu, you'll see helpful reference material that will help you go through the SonoSimulator, including a link to our welcome webinar, which gives an overview of the SonoSimulator, a link to our how-to videos, which go into depth on each feature, our case legend, which has the findings for each ultrasound window, and a link to our support page. In this side menu, you'll be able to access our Knowbology page, claim certificates, go to our ultrasound blog, and learn more about the software. Along the bottom of the main menu, you'll be able to access all the various products, including the course library, the simulator itself, performance tracker, and SonoSim case builder. Let's go into the simulator and take a look at the new case list. We've reorganized the case list to open up horizontally as you open up the various topics. Click on a module and you'll see all the available cases. When you hover on a case, the case history will display on the right. If a module is not yet downloaded, it will be gray, and you'll need to click this button in order to download it onto your computer. To sort the content in the SonoSimulator, you can use these filters. You can see what you have downloaded on your computer, or what is left to download. You can also see everything at once. If you would like to download all content at the same time, click this button.
This release includes two new modules: Biceps Tendon Sheath Injection Procedure Module and LVAD Problem Focused Echocardiography Advanced Clinical Module. SonoSim modules include online course didactics, real patient hands-on scanning cases, and curriculum integration tools like module assignments, course outlines, and answer keys. The Biceps Tendon Sheath Injection Procedure Module is our third MSK procedure module in our shoulder series. Shoulder pain and loss of shoulder range is a common presenting complaint. It's challenging to arrive at a final diagnosis solely based on history and examination. Biceps tendon injuries often coexist with other shoulder injuries, so arriving at a final diagnosis often involves coupling clinical findings with diagnostic imaging along with other types of interventions. The course explores the use of ultrasound to evaluate biceps tendon pathologies and clinical indications for performing the procedure. Biceps tendon ruptures, tenosynovitis, tendinosis, partial tears, and tendon subluxation dislocation are discussed. The ultrasound-guided biceps tendon sheath injection procedure module will provide you with an in-depth understanding of the basic principles of how to perform ultrasound-guided biceps tendon sheath injection. The course contains 13 interspersed practice questions with real-time feedback and concludes with the final 15-question mastery test assessing didactic knowledge. The patented SonoSimulator will help you develop the requisite cognitive task awareness and visuospatial skills required to perform ultrasound-guided biceps tendon sheath injection on a real patient training case, teaching needle guidance using lateral to medial approach and proximal to distal approach. AI-based real-time feedback and automated assessment provide a convenient and risk-free setting to learn how to perform this procedure. Ventricular assist devices can support the left ventricle, right ventricle, or both. This module focuses primarily on left ventricular assist devices. LVADs are implantable pumps that attach to the left ventricle to direct flow to the aorta to help circulate flow to the rest of the body. The primary indication for implantation of an LVAD is severe left ventricular failure. They most commonly serve as a bridge to transplantation, meaning patients use the LVAD until a heart becomes available, or LVADs are used as a bridge to myocardial recovery. Alternatively, LVADs can serve a destination role, providing long-term support for patients that are not candidates for heart transplantation. This technology is rapidly evolving and improving, but does not go without complications. This LVAD problem-focused echocardiography advanced clinical module will provide you with an in-depth understanding of the role of bedside echocardiography in the evaluation of LVAD patients with acute clinical decompensation. The course explores the mechanics of various LVAD types as well as LVAD complications and how to determine underlying etiology. Problem-focused echocardiographic technique is described for assessing the initial evaluation and management of LVAD patients suffering acute clinical decompensation. The course contains 20 interspersed practice questions with real-time feedback and concludes with the final 20-question mastery test assessing didactic knowledge. The patented SonoSimulator will help develop the requisite cognitive task awareness and visual-spatial skills required to perform LVAD problem-focused echocardiography in a convenient and risk-free setting. This release includes one adult LVAD patient problem-focused echo case that follows a problem-focused LVAD protocol. As we continue to scan LVAD patients and grow our LVAD case library, clients will receive ongoing LVAD case upgrades based upon product configuration and license terms. We have added 3 additional DMS protocol assignments in the 3.0 release. DMS protocol assignments are standalone scanning cases which complement our SonoSim modules and align with AIUM practice parameters. These cases allow for full execution of diagnostic medical sonography scanning protocols to enable seamless integration into sonography program training curricula. In the 3.0 SonoSimulator release, we've provided complete standard first trimester pregnancy protocol assignments. The standardized protocol assignment walks learners through the complete protocol on 2 real patient cases utilizing transvaginal scanning and M-mode imaging. As learners walk through protocols, they will have virtual expert guidance to each imaging window and virtual tutorials demonstrating each aspect of the scanning protocol. These protocol assignments complement our OB modules. The Anatomy and Physiology module covers the fundamentals of scanning the female pelvis. The Core Clinical module introduces using ultrasound to evaluate first trimester pregnancies in gynecologic conditions. And the Advanced Clinical First Trimester Pregnancy module then provides comprehensive, in-depth review of sonographic evaluation and monitoring of normal embryologic development and pathologic conditions that arise in the first trimester of pregnancy. The standard first trimester pregnancy DMS protocol expands on this learning, giving users experience performing complete comprehensive exams in a convenient and risk-free setting. This release adds 2 new vascular protocol assignments, lower extremity arterial and lower extremity venous. They both have 2 real patient cases and walk learners through a complete bilateral examination, which incorporates grayscale imaging, color Doppler, pulse wave Doppler with proper angle placement and compression. The DMS protocol assignment guides users through protocol imaging in a standardized fashion. As a user works through the protocol, they will have all the benefits of SonoSimulator training features if they need guidance to find optimal windows, or an instructor to guide them through the images they see on screen. These DMS protocols complement SonoSim Anatomy and Physiology modules such as leg venous and leg arterial. The Anatomy and Physiology modules teach the fundamentals of vascular anatomy and imaging, and the DMS protocols expand on learning and windows needed to scan complete and comprehensive exams. Lastly, in this release, we've added 4 new challenge cases. Challenge cases are unique to the SonoSim library, organized by category. In the genitourinary category, you will find a new bilateral hydronephrosis case. In musculoskeletal challenge cases, there's a new peripheral nerve sheath tumor case. In pediatrics, we've added pediatric buccal fracture, and in vascular, an infrarenal fusiform abdominal aortic aneurysm. We hope you enjoy all the new feature improvements and content in the SonoSimulator 3.0 release. Happy scanning!